Super sensors need super parents, and super parenting usually is something that needs to be learned. Hello, my name is Dr. Francheska Perepletchikova. Today we're going to talk about who is a super parent. Now, children are indeed not born with instructions. And yet, most parents can provide good enough parenting to raise adjusted kids who are happy, functional. Just some of them are still not developing as well as we hope because of their supersensitivity, because they have extra special needs that parents are not able to meet simply because we're not born with that knowledge. And these children may indeed be one of the kids that those parents have. So 3 children, 2 of them are absolutely fine, same parents, same parenting, and a third one is not doing well. Why is that? Because that child has special extra needs, and good enough parenting is just simply not good enough. Imagine a child with no skin. Every time you need to transport that child from point A, where they are right now, to point B, where you want them to be, you need to take them and hold them. And in the process of transporting, just by the virtue of holding them, because they have no skin, you're going to bruise them. So super parenting is a knowledge and an art that we can learn on how to indeed get our children from point A, where we don't want them to be, to point B, where we actually want them to be, without bruising them in the process. Listen, for many, many years, clinical psychologists, psychiatrists didn't know how to help those children either. They've been misdiagnosed with having a bipolar disorder. They were given very heavy psychiatric medications, such as lithium and also ketamine, sometimes intravenous and sometimes PRN, as needed basis. I had children as young as 9 on intravenous PRN, ketamine given to them PRN. If we, clinical psychologists and psychiatrists, did not know how to indeed help those children, how can we expect parents to know that? We're not born with that knowledge. This is like we're not born with the knowledge of how to help a child who, God forbid, has diabetes. We need to go to a medical professional, and they're going to tell us what to do and how to do it. However, until 2017, when I published my randomized clinical trial on dialectical behavioral therapy for children, clinical psychologists and psychiatrists did not have a very specific way of knowing how to help those children, and therefore they were given all of those medications, of course, understandably so, because these children can indeed demonstrate very high level of emotional dysregulation with corresponding behavioral dyscontrol, which can be severe verbal aggression and physical aggression. And sometimes they were giving those medications just to keep them and other people safe. Now, since we've done all of this research on DBT for children, we know we can treat these children. And even more amazingly, we can treat them without psychiatric meds. Super sensors need super parents. When I explain that concept, I usually use a metaphor of firefighters. Firefighters do not start the fires themselves. In parenting terms, this means parents are not being verbally aggressive to their children. They are avoiding prolonged punishment. They are avoiding harmful invalidation, such as criticism, judgment, downward comparisons, shaming, blaming. So parents don't start the fires themselves and don't model force as a solution to problems. Adult temper tantrums when we're screaming at our children, when we're forcing them to do something, when we're using prolonged and appropriate punishment because we're upset, we're trying to get that control back, and sometimes to retaliate. All of that is demonstrating to our children that force is a way to solve problems. What is punishment? Forceful mean to obtain a child's compliance. What is a temper tantrum? Forceful mean to obtain parents' compliance. And if we're criticizing and shaming and blaming our children, what's happening with them? They're learning it and they're doing it to themselves and they're going to do it to other people. We always do to others, we do to ourselves. And the programs, the shaming, blaming, aggression, and force comes from where? The environment in which we live. Firefighters are also not afraid of the fires. In parenting term, it means superparents are not accommodating. Yes, emotionally sensitive and dysregulated children are notorious for programming the parents to start to tiptoe around them. Listen, this transaction between the child and the environment is not just one way. We are influencing our children and programming them, and they're influencing and programming us right back. And of course, fully understandable. We don't want temper tantrums. We don't want all of this abuse. And sometimes what our children can do to us verbally and physically can qualify as parental abuse. Absolutely. We want to avoid it at all costs. But as soon as we start to do that, we enter into the realm of accommodation. Accommodation does not teach our children what to do instead. And even worse than that, on the lower levels, it's signaling to a child, what? I, your parent, don't know what to do with you. I am afraid of you. I am not in control of you. I am not in control of what's going on. You are a monster. Parental authority and child sense of safety goes out of the window. Accommodation is as toxic as being verbally aggressive towards your child. And sometimes parents indeed vacillate between accommodating and perpetrating. We talked about the perpetration when we talked about parents don't start the fires. That's being the perpetrator. And most of the time, this transaction between the child and the parent results in two products: emotional dysregulation for the child and invalidating environment in which parents indeed go back and forth between staying away, trying to avoid provoking, tiptoeing around the child, and then trying to, all the way, trying to get control. Back and forth, back and forth. None of those work. All of that is an illusion of control. None of that is actually effective. It leads to further problems. So instead of starting the fires or being afraid of the fires, perpetrating, accommodating, superparents learn how to calmly and skillfully put down the fires and work on preventing fires in the future. Our parental stance, the dialectic of the existence, always means that for us to be effective, we need to be able to balance two sides at the same time. And because these two sides are complementary, not the same, dialectic, complementary, one side will always be stable and the other one will always be flexible. Our parenting stance, stable side. I love you just because you exist. You don't need to do anything. You don't need to satisfy any standards or conditions. You don't need to achieve anything. I love you just because. The unconditional nature. I accept everything that you do by the definition of acceptance. I don't like what you're doing. If we like something, we don't need to accept it. I accept all your screaming, all your yelling, all of your physical aggression, temper tantrums. I'm not fighting the existence the reality of that and the mechanism behind acceptance is validation. I am validating your distress. That's my foundation for change, right? So one more time, I love you just because you exist. I accept everything you do by validation and no wiggle room. I said 1 hour of TV time. It's 1 hour, not 1 hour and 5 minutes. Stability. And at the same time, I am taking new information. I am deciding on the rules based on information that comes from my child's needs, their perspectives, my understanding what the child needs to do, right? I am modeling the behaviors that I want my child to do. I am not modeling the behaviors I don't want my child to do. I am teaching them skills. I am practicing the skills. I am reinforcing their adaptive responding. Two sides. And it's always an and, both and. Superparenting, most of the time, is not something that we are born knowing intuitively. Superparenting is something that we usually need to learn. If you enjoyed what you heard, please like and subscribe. If you're a parent or a clinician and you would like to take further courses with me, look at the description below. I have a lot to offer. I'll see you next time. Bye.